Dr. Tim Greene coming to you from the ONS Greenwich offices, and wanted to talk to you today about some of the issues we've seen over this COVID pandemic time. And over the course of this past year, we've all had to alter our normal routines. We've had to alter our work routines, our day-to-day routines, and our exercise routines. And because of that, we've seen some very consistent issues in our patients over the course of the past year. And these have been really stress-related issues and overuse issues. And they're coming from really two main sources. So one, we've really moved to a virtual environment where most people are working from home and they're Zooming, and that creates some concentrated sitting. Now, it may not be different than what you've done at your normal sitting job, but it's done in a little more of a concentrated way. We're not commuting, we're not going to meetings. We're sitting and doing that all in a concentrated block. Now, what that does is put some of our muscles at stress. And so the muscles in the front of our hip, the hip flexors, the upper quad muscle, the IT band on the side, and those hip muscles on the side, your deep glute muscles, really shorten when you sit, and they become tighter over the course of time. As muscles become tighter, they don't function as well. They don't hold load as well. So they become weak and they become irritated over time. The second problem that we've had is now that a lot of us aren't commuting to work and we're not going to work, we do have more time to exercise, which is generally a great thing, although we're doing it after we're sitting. So some of those tight, weak muscles now become more irritated. A lot of us, the routines have changed. We don't have our normal gym routine. So what we decided to do, we're going to either go back and run or pick up running again, or go online, do some online exercise classes, HIIT classes, impact classes, and all those things are impact load. So if we place a lot of stress and load on our bodies and the muscles are now weakened and a little bit tighter, that creates a lot of stress. We no longer can hold our joints up appropriately. We no longer can take the load off the bone. So sometimes people, just a little bit of arthritis, if we overload the joint, get a little irritation there. It becomes more over the course of time. Sometimes we get stress injuries in the bone, and sometimes a muscle tendon is just painful. So that has become a big issue over time. We've also noticed with sitting some upper extremity issues, sitting, irritation in your neck, weakness in your shoulders and pain in your shoulders, and those things have become positional. So with seeing this consistently over time, there's a couple of very simple ways to prevent this. And the first way is just ergonomically how you're sitting and paying attention. Sometimes it's hard when you're home. We don't have our normal desk, our normal chair, which are generally a little more supportive. What we want to do for our lower extremities is not sit in such a deep position. You want to sit where your thighs are a little bit above being parallel to the floor. That puts those muscles on less slack. Secondarily, we want to actually keep ourselves in a good postural position for the upper extremity. Sometimes that's the support with the arms of the chair. It's making sure that the computer that we're looking at is really at eye level, and that's going to help keep our neck and posture good and keep our shoulders back. It's really critical that we stretch. It's a very simple thing. It's maybe one of the most simple things we do, and no one really likes to do it. And really taking a focus primarily on those muscles that are being shortened. Your hip flexor, the upper quad muscle, which is generally placing your leg behind you, stretching forward in a runner's lunge stretch, pulling your foot back and trying to get that mobility. Also stretches for the IT band, crossing your legs, bending forward, pulling your knee to your chest. If we just take a little bit of time to do that, that will take away some of this tightness as we go forward over the course of time. Our upper extremities need that sort of stretching too, stretching your trap muscles. And a very, very simple thing we can do is using a band to do some rows. That keeps us strong and gives us endurance in our trap muscles, so it holds our posture over the course of time. So if we combine that, a little bit of stretching, being mindful of what exercise we're doing, not adding in too much load too soon, then we'll overcome these stress and irritating overuse injuries and we'll keep down to our offices.